A very good morning to the Board of Trustees, Presidents of Zhongshan Medical University, beloved deans, professors, distinguished guests, ladies and gentlemen. Allow me to introduce myself. I'm Dr. Kate, your MC for today. Welcome to this year's Symposium on Oral Health held by the new Southbound Special Needs Oral Care Resource and Integration Project. The theme for today focuses on the dental education and new era in special care dentistry. We hope that through this symposium, we will be better equipped with dental knowledge and able to provide a more holistic oral care for patients who are in need. Without further ado, let me invite President of Zhongshan Medical University, Professor Chen-Ming Huang, to give us an opening speech. Let's put our hands together to welcome Professor Chen-Ming Huang.
Okay. Good morning, ladies and gentlemen. May I welcome all of you to the conference. Mr. Renato and Mr. Angelo, Vice President of Manila Central University. Ms. Garcia, please, I just want to know you. Dean of Manila Central University, and Ms. Nia, Dean of University of Indonesia, and Mr. Tong Min San, Dean of Hanoi Medical University, and Mr. Lauromanas, Dean of Chiang Mai University. Yes, welcome. Mr. Arturo, Dean of Our Lady of Fatima University. Mr. Krompoji, Chair of Mahido University. And Mr. Chen, Dean of Zhongshan Medical University. Ms. Chen, Chair of Taichung Veterans General Hospital. Mr. Wang, Chair of Zhongshan Medical University International Medical Service Center, and Professor Gao of CSMU, Mr. She, President of Huangliang Biomedical Technology Company, and our honorable guests and all the personnel of Zhongshan Medical University. Good morning.
Good morning.
Yes. And it is our honor to host the International Symposium on Special Needs Oral Care Resources and Integration Project with the Zhongshan Medical University School of Dentistry. We gather professions from overseas to share the significant experiences in special needs oral care. In response to the trend of aging worldwide, with substantial experiences, we have 4 special needs oral care and the new southbound program promoted by Ministry of Health and Welfare. Professor Gao, our project director, says about propelling special needs patients oral care in Taiwan. We strongly believe in the people-oriented principle, making good use of multilateral technical exchange and shortening the social and cultural distance we have. Furthermore, through international medical cooperation, we can deepen the relationship with other countries and create stable and long-standing partnership goals. On behalf of Zhongshan Medical University Hospital and School, we sincerely appreciate your participation and wish the conference a great success. Thank you.
Thank you, Professor Huang, for the inspiring speech. Next, we would like to invite Dean of College of Oral Medicine, Professor Chen Yun Chen, to give us a word of two. Please. Okay, next, we are very delighted to have our Chief Director of this project with us today, Professor Chia Zhekao. Let's welcome him to give us a few words.
President Huang and all the distinguished guests. On behalf of Zhongshan Medical University in Taiwan, I sincerely welcome you again. We have been carrying out the Taiwan New Southbound Special Need Patient Oral Care Program for 6 years now. And we appreciate the participation of all schools involved. Thanks to your support, we have been able to provide excellent care and treatment patients with special oral needs. We have all demonstrated our commitment to humanitarian medical care and fulfill our responsibility as doctors. We believe that which the care provided by all the physicians, all the dentists, these patients will regain their health. 2 days ago, we visited a hospital in Taiwan, observed unique medical practice and a grassroots medical unit, and even attended an international conference in Kaohsiung. I believe that you have a deeper understanding of this practice now. Today, we back to Chongsan Medical University. We will engage in exchanging between schools and hold a practical training session in this afternoon. We expect all of you can gain more experience today. Thank you so much.
Thank you, Professor Cao, for the inspiring words. Before that, Professor Cao, we have Dr. Angelo Maduli and Dr. Renato Cruz would like to give you a gift. Okay, please stand to the stage. Okay, we would like to invite Professor Chen Ming Huang and Professor Gao to the stage.
Manila Central University.
Okay. Okay.
Let me read the plaque, what's written in the plaque. This plaque of appreciation is awarded to Chongsan Medical University in recognition of the university's significant contribution on the social learning and participation of Manila Central University and College of Dentistry for the promotion and implementation of interprofessional collaboration through special needs oral health care program. Given this 25th of March 2023 at CSMU Typhoon City, Taiwan, during the International Symposium and the celebration of the 94th Foundation Anniversary of MTU College of Dentistry, with the theme, Transformative Learning, Keys to Successful Treatment Outcomes. Signed by our Dean, Dr. Maria Cristina Orla Garcia, our Vice President for Academics, Dr. Angelo Maduli, and our Vice President for Planning and External Affairs, Dr. Renato Tanchoco Jr.
So, Mr. President, thank you so much for this collaboration, and also Professor Cao, thank you so much. Manila Central University is really very grateful for this collaboration. Thank you.
Yes, it's our pleasure. Yes. Okay. I think we take off the mask for the photo group.
Okay, thank you so much. Okay, now we would like to invite Chiang Mai University to give a token of appreciation. Okay, now we would like to invite Universitas of Indonesia.
Yeah. On behalf of Faculty of Dentistry, Universitas Indonesia, we would like to thank you to invite us and the collaboration that we have been doing so far. And thank you especially for Professor Kao, been so nice. And we also receive some of the instruments and the assistance to support our special needs in Faculty of Dentistry, Universitas Indonesia. Thank you so much.
Thank you. Now we would like to invite Hanoi Medical University. Okay, thank you. Next, we would like to invite Mahidol University. Okay, thank you so much for our partner universities. Okay, from our side, we would like to invite to give you our token of appreciation. We first like to invite Dean Garcia from Manila Central University to the stage. Next, we would like to invite the Dean of Universitas Indonesia, Dean Nia Ayu Ismaniati Nur Hadi. Next, we would like to invite Dean of Our Lady of Fatima University, Dean Arturo de Leon. Okay, next, we would like to invite Professor Kolanich, Dean of Chiang Mai University. Next, we would like to invite Professor Tong Min Song from Hanoi Medical University. Okay, moving on, we would like to invite Professor Fong Tan Tip. from Mahidol University. Okay, hi. Now we would like to take a group picture. So everyone try to gather to the center. Yeah. Okay. Okay, let's take a group picture. Okay. Yes, please have a seat. Now, ladies and gentlemen, okay, let's move on to the next agenda. Okay, it is my pleasure to introduce Professor Mark Wolf, the Morton Amsterdam Dean of the University of Pennsylvania School of Dental Medicine. With over 30 years of experience in the field of dentistry, Professor Wolf is a highly respected expert in oral health and a prominent figure in dental education. Professor Mark Wolf received his Doctor of Dentistry and PhD in oral biology and pathology from the State University of New York at Stony Brook. He has held academic positions at Stony Brook University School of Dental Medicine and NYU College of Dentistry. He has also published over 100 articles in peer-reviewed journals and has been awarded numerous grants and honors for his works. Please join me in welcoming Professor Mark Wolf to sharing with us an introduction of the Care Center for Persons with Disabilities at University of Pennsylvania. Please welcome Professor Mark Wolf.
Thank you for having me, and I'm sorry I'm not able to join in person, but I hope that we can have as much interaction, even though I'm presenting remotely. It's an exciting subject to speak about globally, to see interest in helping to work on patients with special care needs. At Penn Dental Medicine, we have made a commitment that our education program is going to help train every dental student to a level of competency in managing 90 to 95% of persons who fit the definition of having a disability. There are many definitions, and this is one that is just prepared as part of the Americans with Disabilities Act, a physical, mental, cognitive, or developmental condition that impairs or interferes with or limits a person's ability to engage in certain tasks or actions or participate in typical activities of daily living. And what we do know about this is that patients and their families and their caregivers face a tremendous barrier to receiving routine dental care. The medical conditions complicate care. The patients frequently cannot tolerate any procedure or are uncomfortable in the dental setting. And it frequently results in emergency conditions emerging because they haven't been receiving the preventive care. Their caregivers or they themselves have not been trained on how to best maintain their mouth. And we see that operating room and sedation is frequently the only treatment that's offered for many of the patients with disabilities. And the one thing that we know is that serial operating room or sedation care does not help prevent the disease, nor does it actually treat chronic diseases like periodontal disease or dental caries. The other thing we recognize is that where special care, particularly in the United States, has always been trained as part of a pediatric specialty, so that we had specialists who were capable of managing, we have to recognize that nearly 80%, between 80 and 90% of the total population with disabilities are over 18 years of age. The implication of that is that if every general dentist does not have some capability, this will be a massive problem in the future as persons with disabilities age. There are over 1 billion individuals in the world with a disability that interferes with their activities of daily living. In the United States alone, that number is over 60 million individuals. So we asked the question at Penn Dental Medicine of should every graduate be able to manage the caries of a patient with Alzheimer's disease in a nursing care facility using caries management strategies and diet management. Can we do fluorides, and can we have staff or dentists doing fluorides? Can we place patients on diabetic diets? Can every graduate work with a person with autistic spectrum disorder and reduce that fear that patient has in the chair, help desensitize them to either the brightness of the light or the aromas or the facility, awkwardness. And should we be able to develop these accommodations? At Penn Dental Medicine, we felt this was such an important part of dental education for every student and clinical experiences. We put it on the same level as teaching a dental student how to do a crown or a denture or how to use CAD/CAM. We would never think of neglecting to teach these concepts to our general dentists, and we have historically neglected teaching this to everybody. We asked the question, is it a disability, or do we need to find the accommodation that makes that person comfortable sitting in the chair? So we asked the question of how to innovate the dental education process so that every one of our graduates can provide exceptional care to the 90 or 95% of the persons with disabilities. Can we teach them how to communicate with the patient, because we can never speak over the patient, as well as the caregivers? We learn how to speak to parents when we treat children. Do we really train our dental students how to speak to the caregiver and the patient when we have a patient with cerebral palsy sitting in the chair? They may not be able to communicate back to us, but they may understand everything. It requires a real sensitivity to understand that the individual is cognitive and has the understanding. And what can we do to improve this? So we provide a real state-of-the-art facility to train every dental student in how to provide comprehensive care. And we offer continuing education to any dentist worldwide who's interested in logging in and seeing our programs. We believe that it has to train staff. We not only get people to take the courses online, but we invite them to come in and join our student body in actually learning how to deliver this very important care. We are doing research, and we're working to make information on how best to care for people available to everyone. And it should not only be centers that put people to sleep, it should be centers that find the space to allow a person to sit in a wheelchair and receive care in their wheelchair. We need to be able to treat patients. I've treated patients on the autistic spectrum with autistic spectrum disorder on the floor because that's where they are most comfortable sitting, and I sit next to them and do examinations. I've done examinations out in the car. This is actually the center at Penn Dental Medicine. And I need to point out that every school does not need to prepare a center that has everything. We decided to put everything in this center so that we can show our students everything that is possible. The stripe on the floor that you see here is a textured stripe. That allows a patient who is blind to use a cane and find the restroom without being guided there by somebody that has vision. We can say the second door on the right is the restroom, and they can find their own way to the restroom. We have countertops that are high for people that are standing and low for people that are in wheelchairs. We have consult tables that rise or fall. Our rooms are set up such that some are quiet rooms that can be closed for people that need that privacy or may be loud, and there are others that are going to be open and allow open access. Some of our equipment looks quite standard with equipment that's over the top of the patient. That's actually not made for everybody. What we do need for some people is that there is nothing that a child or adult can grab with their hands. So we design rooms. This is one of our consult rooms. That table can rise if the person's in a tall wheelchair and we're having a conversation, or that table can be lowered. The TV allows us to show parents, caregivers, and patients additional items about the care that needs to be delivered, and we set up an environment that's friendly to the patient and to the caregivers. Doing this is a demonstration to our students of what is possible going forward. We have a wheelchair lift in there. I have to tell you, it's a $60,000 device that can raise and lower people that are morbidly obese, weighing over 300 pounds, 150 kilos or more. But the truth is, we use it very little. We have learned how to accommodate to working on a patient in a wheelchair because we have the space to do so. You see behind this a mobile cart, extra long arms on x-ray machines. We need to teach our students that when they make that investment in an office, they need to invest in a room that has a little extra space. We use hover chairs. I don't have a picture of it. The chair sits on a bladder that when you flip the switch, the chair, even though it weighs 500 or 600 pounds, can just be pushed with a couple of fingers so that it goes against the wall. This was a special room that we put in place that had sound deadening so that for patients that are auditory stimulated, it's quiet. The air exchange was actually set up so that it's an extra high volume of air exchange for those that have sensitivity to aroma. There are other patients that we actually use aroma to help calm them down. We have both a dental chair in this room and a mobile cart that we can pull up and deliver the care here. Patient has nothing that they can grab if this is a grabby patient. Or a patient with Lou Gehrig's disease, ALS. We brought this patient in on a stretcher, had not had their teeth cleaned in 10 years. They just needed a place that they could be slid in and have dentistry done on them. And when they saw this, they were literally in tears because they have not had that feeling in their mouth of being clean in literally a decade or longer. What we're trying to teach our students is how to accommodate patients, a variety of individuals that look different, that act different, that feel different. And we feel that this is a necessity, a requirement in our education, so much so that a student spends 10% of their week for a complete year in this facility treating patients. We have the ability to change the way students feel about treating persons with disabilities and grant individuals the capability of doing this in a natural format in their own practices. So as I was introduced originally, I was a private practitioner for the first 10 years of my career before I went back to go get my PhD and pursue an academic career. I opened a practice that was a very high-end general dentistry practice doing aesthetic dentistry, and at the same time made space in my schedule daily so that I could treat persons with disabilities. It was a necessity for me to be able to do this because I believe that failing to deliver this type of care to patients is going to doom our society to a very long-term, difficult period of time where we're not going to be able to treat a substantial aging population, whether we're speaking about a person with Alzheimer's or a cognitive disease or Parkinson's disease. We have to start training so that our students are comfortable in delivering this type of care. Penn Dental Medicine has gone a long way to do this, and we will assist anybody with curriculum, with assistance in training people. We have a very strong commitment to seeing this going forward. I hope that satisfied the discussion of a brief presentation. I would love to be able to take some questions.
Is there any question? Please feel free to ask questions. Okay. So far, there's no question. We would like to thank you, Prof. Mark Wolf, for sharing with us such an eye-opening insight where dental practices adapts equipment to improve dental care for persons with disabilities. Thank you so much, Professor Mark Wolf.
Thank you. I would like everybody to think about what the possibilities are and not to think about the barriers for achieving this. This is a very underserved population that truly needs the help of dental educators to bring forward a new world where they can have health also.
Okay, thank you so much, Professor Mark Wolf.
Thank you.
Okay, before that, we would like to have a group picture with you, Professor Mark Wolf. Okay, please look into the camera on the count of 3. Okay, 1, 2, 3. Okay, one more time. 1, 2, 3. Say cheese.
Cheese.
Okay, that's great.
Thank you very much. Everybody have a wonderful conference.
Okay, thank you. Okay, next.
Recording stopped. Recording in progress.
Okay, next. Next we will have Okay. Next, we have our Dean of College of Oral Medicine of Zhongshan Medical University. We have Professor Chen Junchen. Let's invite him to give us a word or two.
So good morning, dear guests and experts. I am Chen Jin Chen, Dean of College of Oral Medicine.